We went on a family vacation to the cabin, and him and his brother were riding bikes, and they collided. A couple days later, he started having some low back pain, and we just, you were in a bike accident, you're okay. We went to the pediatrician, and they ended up sending us to get labs, and ended up sending us here, met with Dr. Dan, and he did some scans and tests and came back and told us that he had neuroblastoma.
We met Westin last year, and he came in with really bad bone pain and some very abnormal looking imaging studies. And we worked him up and pretty quickly found out that this was because of neuroblastoma. And based on his age and the extent that it was when we found it, it was metastatic, and we needed to treat him with the highest level of therapy in order to be able to get a cure for him. Neuroblastoma is a cancer that comes from the neural crest, which is cells that typically are part of development, and they are on the sides of the spinal cord. So that's why we often see on the either end of the spinal column, that's where the tumors often start. So sometimes it's in the adrenal gland, sometimes it's in the chest. It looked like Westin's came from the right adrenal gland and spread a little bit in his belly there.
In traditional medical care, we would treat children by the type of cancer they have. And so in general, leukemia or neuroblastoma, and everyone with that type of cancer receives the same care. But we know only a percentage of patients will respond to that treatment, not everyone. In precision medicine, we're trying to understand each child individually and the genomics or the biology of their cancer, what has made their cancer grow, and then what is driving their cancer, and are there medications that are specifically targeted for that child that may be different than another child with the same cancer. But understanding what are the best medicines that will help that child, not only what are the medications that this child might respond to, but what medications will this cancer not respond to and maybe potentially be resistant to. They're still young. They still have a whole lifetime to live. So really important in pediatrics, because we want to identify targeted therapies that are more targeted just for the cancer, to leave the rest of the body alone so that they're not having those long-term side effects, so that they can have the right treatment for their cancer now, so that they can not only survive their cancer, but thrive for the rest of their lives.
It brings you peace knowing that they are doing everything they can and looking at all the options and looking at his genetic makeup and how he's going to react to certain medicines and getting the very best for him.
So when we diagnose a child with cancer, it changes everything for that family, and it's a very emotional and challenging time for the family. So we do try and explain precision medicine as we're explaining that this is the diagnosis, this is how we're going to treat your child's cancer, but then we're able to tell the families, but we want to understand your child as best we can so that we can know exactly why this cancer happened potentially, what are the important genetic changes in that cancer, and is there anything better that we can do to make sure that your child not only is cured, but does not relapse from this cancer.
I can't wrap my head around what they're researching and doing. She took us in the one room and showed us his neuroblastoma cells under a microscope, and just the fact that they know different cancer looks, neuroblastoma looks like this and leukemia looks like this, and knowing using the different medications on those cells to see how they react is just so fascinating and exciting.
So it's a lot of explaining new terminology to the families, talking about diagnostic tests that they're going to have to go through, treatments, and what the time frame is going to look like in the short, medium, and long term. It's a lot to adjust to, but families like Westin's are amazing. They've just gotten him through so much, and he's done really well. We're really proud of him.
It has been wonderful working with Penn State. It's great. We actually went to another hospital and we said how much we missed Hershey, because you walk in, all the nurses at the desk, all the staff at the desk know your name. They say hi. All the nurses, we've had all the nurses. We know them. They know us.
This is such a vulnerable time for the patients and their families because they're getting such a devastating diagnosis. And you really need the expertise of some of this team that works together, from doctors, nurses, social workers, music therapists, everyone. We're all dedicated to taking care of these kids. And he just needs to continue following the course, and we're going to continue to follow him into adulthood. Because
of the research of my last 20 years, I've seen that change. I've seen kids where we used to tell them they had a 30% chance of survival, now it's over to 70% chance. We are seeing kids live, and we're able to cure cancer because of the research, because of the caring and the fundraising and the community coming together. The support from Four Diamonds is really making this happen here at Penn State. The children treated here have the best outcomes possible. And because of Four Diamonds, we're able to do that. You know, I love the theme from this year, A Home for Hope. That's what this money brings. This money brings hope to all of these children, to all of us who are caring for those children. It brings us hope that we are going to do better and that it's going to get better.
Just so grateful. Just all the work that Dr. Sholler has done and all the advancements that she and all of her colleagues have made. It's just amazing, and I'm just very thankful for that.